because of the skill set required to be in that position, and yet they're the ones that are deeming who's going to get paid what, that impacts both the doctor and the patient.
So yeah, I mean it's very interesting. I mean, this is one of the kind of goes on to the idea that whenever you get a government involvement in a market, you essentially distort the market, because there's a market price for something, and then there's what Medicare would pay for something, and the only the true quote price of that procedure is what the market says that procedure should be, not what some bureaucrat says it should be. So you get this gap.
Exactly.
Yeah, you get a gap between the two, and somebody needs to pay for that gap. So the question is, who is it going to be, right? Is it going to be us, or is it going to be them?
Well, it ultimately is us, because a government doesn't pay bills, and neither does a hospital. It's the patients that go into it, and so they end up having to either shift costs around, reduce the actual service, shortcut or cut corners on the service delivered to the patient, or make up for it on the next guy coming in.
Well, I mean, that right there is basically a huge problem right now, because essentially, if you have a government agency essentially set these rates and say, okay, we're going to pay X amount of dollars, essentially right now, it's when a doctor takes a Medicaid patient now, they're essentially running at a loss. So they have the choice of they either turn the patients away, or they take the patient and then essentially turn around and shift the cost somewhere else. So, for instance, like Walgreens, as in Washington State, as of April 16th, has basically said no more Medicaid patients. Period. We're not gonna. We're losing money, and we're not going to keep on taking those new patients. So for the doctors who essentially still are taking those Medicaid patients, or well, I guess they still are, or whether they're taking on new ones, now they have to take a look at those patients and say, okay, these people are going to run me at a loss. I have to get this money from somewhere else. So either I have to take it out of my own pocket, which at that point they'll go out of business if they get too many, or they have to go and get you have to go and take that money from other people who have private insurance, or who are, and then the people who are paying out of pocket essentially just get completely reamed in terms of how that cost is being shifted. So essentially what they're doing is they're taking the people with insurance and or people paying out of pocket and taking money out of their taking money from them to go and subsidize the what the government says the quote rate should be for a particular procedure. So that right there is going to push everybody else's costs, so that the health insurers costs up, and also the people who are paying out of pocket, those costs are going to go up. And there's a direct correlation between the what the bureaucrat is saying a particular procedure will cost, and what what the market says the true cost is. So that's where you get that cost shift.
Yep, exactly. Okay, what? So I guess that kind of from my standpoint, those are kind of the key areas. If you were to really have a rational delivery of healthcare, you'd have the reduction in the regulations, the insurance industry, the supply, i.e. the licensing, the tort reform, innovation, and then finally the cost being based on outcome as opposed to, or the fees being based on outcome as opposed to the cost management.
So, I mean, I guess one of the things I probably also wanted to cover was, the influence that the FDA has too. And in terms of, if you want to talk about interference in the medical market, well, the medical market essentially got slammed on the healthcare bill too. There's a whole bunch of new taxes that they're going to hit, or they're going to be hit with, in terms of, their operating, money that they could basically be putting into research and development, or developing, well, essentially new products or employees. Instead, there's going to be a heftier cut now taken out of them to essentially fund this healthcare program. And then also what those clients or what those companies have to do in terms of trying to bring a drug to market or a medical device to market, going through all the FDA trials, it just adds millions and millions and millions more that essentially we as end consumers have to pick up the tab for, and under the guise of, oh well, it's FDA approved, it's done these particular tests. So we're essentially being sold the idea of, oh, because it's gone through this process, that it's worth us paying whatever percent, maybe 20%, 50, 100, in terms of the cost that's added to those products, because they have to go through all those FDA trials and all the government stamps of approval that you have to get in order to bring something in that particular field to market. When really in the rational society, what would happen is essentially some other competitor would take a look, and if there was issues in a particular product or issues in a drug or something like that, the best watchdog that you can have is essentially look at is your competitor, because a competitor is going to be wanting to try to fill a market and try to deliver a better service or a product by looking at the holes in your particular offering and say, hey, I can do that better, at a lower cost, or do it in a better way, or improvements in some particular way, as opposed to sticking a whole bunch of money into a government program and hoping that the outcome. I mean, there's no incentive when the government does it to make sure it's done correctly. Whereas, a competitor who's in business, their incentive is, well, we have to, if I make this a better thing, I can grow my company, or, keep from going out of business, maybe find a particular, procedure or a new product to turn the company around and deliver more value to the end user. So that's just another in terms of, one of the arguments for, again, going back to the whole, they try to control costs. Probably one of the best ways to control costs is the whole idea of competition. People are always going to try to, or companies are going to try to be more and more competitive as time goes on, and try to make products and their services better to have a better value offering for a client.
Yes, that's an excellent point. Absolutely, excellent point.
So I guess, one of the things I also wanted to cover was, many times we'd hear, or we'd have an argument from the other side, or from the left point of view, saying, hey, well, we've got to do this because what are you going to do? Are you just going to let somebody die in the street? It seems to be a compassionate argument that's made as to why we need to do this healthcare reform. So, in a rational society, though, how would you actually answer that question?
That's a good one, and you're right. People bring that up all the time, and I think they're trying to paint this picture where the guy's laying on the side of the road in some busy intersection at noon, and people are basically walking over him. I don't think anything could be farther from the truth, especially if you lived in a rational society, because fundamentally, even today, with all the stuff that people have to deal with and all the taxes that they're being strangled with, and et cetera, fundamentally people are good. The average person, and especially so in the United States, that people are fundamentally good. And as a result of that, you see this time and time again, even today, when people are just dying, they're being choked, and yet when some catastrophe comes up, some form of charity is shown to them, whether they ship stuff to the Haiti when they had the issue, or when you have some particular problem here within our own borders, or whatever. The people will come to the rescue, based on the fact that, as I said, most people, the vast majority of people, are good. Now, properly, in a proper society, charity would be key, and charity would be rampant. If you look at the United States in the late 1800s and the early 1900s, when they didn't have a lot of the type of procedures and insurances and all that stuff, when something happened to a particular person, their house burned down, their business burned down, their farm, was flooded out, whatever it is, the local people around them all got together to help, and in many instances, the person that was inflicted with whatever catastrophe ended up better off than before the catastrophe happened.
No kidding.
That's right. Because the people got together, and that was a sense of comfort, and that was a sense of security, and it was a sense of the benevolence that you have in a world where people are working together, where they don't view each person next to them as a parasite like you do today, that they work together. And so I think those would be the underlying answer to that question. But I think what's more illuminating is that fundamentally